Hi, I'm Doug Thompson from the Coy Center, and I want to talk to you a little bit about a course that we have, and it's called Wellness Week. We call it Wellness Week. It's in April, from April 1st to 4th, 2020, and Wellness Week is really a course about you and about how you can implement periodontal medicine into your private practice. One of the things we know about implementing certain procedures or techniques into practice is that if we do some of these things for or on ourselves, we have a much better understanding of what happens and how we could expect patients to accept these types of treatment from us. So what Wellness Week is really built on the platform of our course called Integrating Periodontal Medicine to Reduce Systemic Health Risks. And what the idea behind that is we learn and use periodontal medicine and the periodontal medicine platform to start to teach our patients about other areas beyond the teeth where they could be healthy. So the subtitle of this course is The Journey to a Wellness Practice Begins With You. And what happens at the course is we're going to spend an entire day talking about periodontal medicine. During that day, we know there's a relationship between periodontal disease and heart disease. So we will actually have some testing companies here that will do a test of the carotid arteries to look for plaque in the arteries and give you your chronological age versus your vascular age. Sometimes they're quite different. We'll also have a lab here looking at your vascular inflammatory biomarkers. So we'll have a blood test that will help evaluate where you are on your journey with inflammation that results or that revolves and is important in vascular disease and in early dementia and in brain disease and in stroke risk, and that's a very interesting thing. We also know that we have to move beyond periodontal medicine and talk about sleep and airway issues. So we'll have a day dedicated to sleep awareness and sleep diagnosis, and a day talking about how we can incorporate certain screening, diagnoses, and treatment modalities into our practices as it revolves around sleep and what we would now call airway management. So we would have that part of it. We'll also have a half a day of a presentation from a physician talking about the collaborative opportunity in relationships and how we can better work together to satisfy patients and create a cross-referral system that actually generates more patients to the practice and increase loyalty from the patients that you have in practice. So that's going to be an important component. Our physician input will also help establish the significance of some of the disease conditions that we look at and how it affects systemic health and why it's important for us to not let that conversation just stop with the teeth, but help to move that conversation beyond the teeth as well. This is also a great course to bring your most prominent hygienist or any person in the office that might be a key influential person in adopting new protocols, new procedures in practice. Going to be really important to have somebody else help you so that you don't have to be the total communicator of all the information that you learn at Wellness Week. So it's really a great opportunity because additionally, in addition to periodontal medicine, airway management, and 5 or 6 other dental conditions that we have to become experts in, we're going to look and get briefed on the lifestyle factors that we all need to be aware of. Things like stress management, things like hydration, things like nutrition, how to identify metabolic disease. What are the key pieces of information that we'd want to give our patients about these areas that could significantly alter their life? We also know that stress management, nutrition, hydration, the amount of sleep that we get, your exposure to pollutants, if you have any issues with yeast involvement, gut, sinus issues, this could tell us something about gut health, your exposure level to certain pollutants, mercury toxicity, mold, other types of things also affect how you react to a certain disease condition. So we're going to help explore those areas. and look at how you can incorporate lifestyle medicine into your practice as well. So come join us for Wellness Week. It's fantastic. You learn a lot about yourself. Remember, your journey to a wellness practice starts with you. So we want you to experience a lot of these things, and especially some of our metabolic testing. We have a world of problems today with patients with diabetes, type 2 diabetes, insulin resistance, and metabolic syndrome. So come join me, come join our physicians, and come join our airway management team so that we can further explore how wellness concepts and health beyond the teeth might fit for your practice. Till next time.